Hi, in today's installment of Comments on Psych Meds by a Psychiatrist, I was going to talk about Rexulti. And I usually include the generic name, and I will. It's a brexpiprazole, but I had to actually look it up. For some reason, this is a medication that I have pretty universally referred to as Rexulti, the brand name. The only thing that I prescribe it for is as a add-on or a booster for antidepressants. So a patient who has not responded or has responded minimally to an antidepressant and is dealing with a significant depression, which they usually are by the time they come to see a psychiatrist, I will consider adding Rexulti to that. So that is the main, and like I said, the only thing that I prescribe it for. It is indicated for the treatment of schizophrenia, but I don't treat a lot of individuals with schizophrenia, and I think there are other agents that might be thought of before Rexulti. The dose range is 2 milligrams. It does come in a variety of dose strengths, all the way down to a quarter milligram and up to 4 milligrams. But I almost always am targeting 2 milligrams. In a few instances, I've bumped it up to 3 milligrams to try to get a little extra benefit, and I've pulled back to 1 milligram for certain patients. Although side effects are not very common, and I know that it's kind of a dubious thing when a psychiatrist says that about a medication, but for the most part, in my experience, patients tolerate it pretty well. It either does work very well and does provide that boost to the antidepressant, or it doesn't do quite enough and we have to look for other strategies. But I have not really encountered people having to stop it because of intolerable side effects. I do recall pulling back to 1 milligram for a patient, so I vaguely remember it may have been due to fatigue, but again, that's not really something that I encounter commonly in patients taking Rexulti. The main thing to be concerned about is the possibility of something called tardive dyskinesia, which is reviewed elsewhere, but it is a potentially serious, irreversible side effect. So it is a consideration, and that's why we reserve adding Rexulti only for patients with a severe depression that's not responding to an antidepressant alone or a primary antidepressant alone. So that's basically what I have to say about Rexulti.